All right, so today we're going to talk about human anatomy. Nikki, how much do you know about your own personal body?
Well, I'm still learning, still starting to work out, so
Yeah.
pretty new to this, the whole anatomy stuff.
So would you say that you understand how your joints work with the muscles and your mechanisms?
No, not exactly.
Perfect. Well, then that's a good place to start, I suppose. Today I'm going to talk to you specifically about that kind of stuff. I'll give you a general overview of what human anatomy is like, me being your personal trainer. Now, human body basically is broken down into parts. There's muscles, there's bones, there's tissues, there's tendons. Now, what is human anatomy? Can you give me an example of what human anatomy would be like?
How your body works and how everything works together, I guess.
Essentially. So the actual general definition of human anatomy is the study of human body in respect to all parts of their relationship to each other. So basically how your bones interact with your muscles, interact with the ligaments and the tendons that hold everything together, and your joints. So in order for me to do this, there's a lot going on. It's not just me lifting my arm and dropping my arm. There's muscles, there's fibers that are launching signals throughout the brain, causing me to be able to make this movement. This isn't something that you can just do without learning how to do it. You're not born knowing what you're doing. Human anatomy is something that's learned over time. So now, me being a personal trainer, I'm going to explain to you just exactly why this is important for us to know. Basically, it's because I'm going to interact with a lot of other personal trainers in my career. I might also interact with people in the profession of medical health sciences. And for me to be able to go, hey, this person has to be able to fracture versus just to say, oh, this person hurt their leg. It's an interesting science to have a background in and a good base of knowledge. So that's always a good place to start. Now, so basically, the adult male human body's got 206 bones. You're born with 300 as a child, but basically through the growth pattern, bones fuse once they become longer, and then you stop growing, and you actually end up, because they fuse together, you lose approximately 94 bones in your body. It turns into the 206 that we see here. And I guess a rough estimate that scientists have come up with over the last 30 years of studying the human body, they've decided that there's between 640 and 850 muscle tissues in the body. That includes your hair follicles. Each hair follicle is a muscle tissue. That's why there's a discrepancy in the numbers. Now, the three major muscle groups in the body are skeletal, cardiac, and smooth. Your skeletal muscles are the ones they support your bones. Basically, this is how I'm standing right now. This is how I can walk around the room. It's how I can have a conversation with you. Your cardiac muscles are the ones around your heart. They're the ones they're involuntary. You have no control over them. They're the things that cause your heart to beat. And your smooth muscles are actually in your digestive tract. So they're the reason why you're able to digest all the food that you're eating. They're again involuntary, while your skeletal muscles are the only ones that you have voluntary control over. Now, in personal training, we're going to use a lot of different terms. You're not just going to say your head, obviously. You're going to use directions, and these diagrams basically just point out the anatomical directions you're going to use. For instance, if I were to say, I wanted to talk about my elbow joint in relation to my shoulder joint, I'd say that my elbow joint is distal from the actual proximal joint of my shoulder. That's a good way to describe things. As far as actual breakdown of the terminology, anything that you talk about being above or superior or cephalic. Cephalic refers to your head region, but anything that's above something in your body, say my head is above my chest, or my head is superior to my chest, or my chest is inferior to my head. Those are your best ways of describing your body planes. Yeah, so anterior is in front, or the front. So my anterior surface of my body is my chest. Now, the posterior surface is always going to be on your backside. So my back, my glutes, my hamstrings, they're all on my posterior surface of my body. As well, distal kind of refers to, like if I was talking about my arm, my fingers are distal to the rest of my arm. Whereas the elbow joint would be proximal to my fingers in relation to the whole arm. Medial, anytime that you move away, anytime you work towards the midline. So if I were to move my hand from here to here, that's a medial movement. And if I move my hand from here to here, that's a lateral movement. They're very useful terms, especially when you start talking about muscle movements and contractions. Talk about adduction and abduction is the movement of your arm away from your body, laterally moving your arm up or bringing it back down medially. These are all great describing terms, and you have to use them. So I'm going to use them when we train together, and it'll help you to understand what I'm referring to. And then also, your body can be split into 3 different planes. Now, if Sandro stands up for me and turns, so his body is going to be divided down the middle here. And that, is your sagittal plane. So it divides your body into left and right halves. And when you're referring to it, the left and right half are supposed to match. They're supposed to be the same. There's never supposed to be an imbalance or any indifference in it. Now, then you're going to be split top and bottom, so through the middle, and it's your transverse plane. The top half is going to hold all of your major organs, where the bottom half is mostly limbs. And then the last one is the coronal plane, or the lateral plane, and it splits your front and your back. Those are mostly important when you're doing things like, you actually have a seat, MRIs, or any type of body scan to know which part you're looking at, because it splits it into planes, so you can see all your major organs, and your muscles, and your bones, and how everything breaks down. Now, body planes is also important because you can refer to movement patterns. So a movement pattern, for example, I'm going to move my both my limbs, both my arms out. I'm going to adduct my arms up. I'm moving that along the coronal plane or the lateral plane. This isn't a movement that occurs in any other plane of the body. Now, if I were to move my arms forward and horizontally adduct the arm, you're moving that arm along the sagittal plane. So again, they're useful mostly when I'm describing it to another personal trainer. You won't really ever encounter that when you and I are having a conversation, especially at the gym. That's just too complex, but for purposes of you learning this, it's just nice to know. So, your articulations are your joints, and there are multiple joints, but there's basically only 4 major types of joints. There's hinge joints, there's ball and socket joints, there's sliding joints, and there's pivot joints. Now, sliding and gliding joints, very small. Basically, a small bone inside is going to move within another bone, and it allows a little bit of movement. Actually, your radiocarpal joint, which is between the small bones in your wrist and your hand joint, they allow for slight side-to-side movement, and that's the only real gliding joint you have besides in your foot, the exact same joint. Your hinge joints are joints like your elbow, your knee, so your tibiofibular joint, and those are, again, major muscles, major joints. Then your ball and socket joint are major ones. They're your hips. They're like the places that the large bones fuse into your large part of your limb. Same thing as your glenohumeral joint, which is your shoulder joint. Okay, cool. Then there's also there's major joints that we like to talk about that we're always going to use. Anytime you move your arm up, forward, you're going to use your glenohumeral joint, which is your major shoulder joint. As well, on your back side of your body, there's such a thing called your shoulder girdle, and it's another major joint that you can use in every single upper body movement you do. No matter what exercise it is, if I'm going to do a push-up, I'm stimulating the joints. I'm using the muscles, and I'm going to use the rotator cuff, which basically hold in place my glenohumeral joint. Now, if I were to talk to you about your hip joint, anytime you do a lower body movement, even anytime you do a torso stability movement, you're going to use your hip joints. Your hips are always going to be involved in everything. This is why there are a few ones that we like to talk about that are very important. Your carpal joints are very important because anytime you use your hands or you use your limbs for anything like that support weight, you have to have strong carpal joints. Now, basically, a joint in its defined term is anything that allows your body to perform a movement. It's going to use your bones and your muscles to actually apply this movement. And now, for me to, again, like I said in the beginning of the presentation, I said that if me doing this is an entire body movement. Well, the reason why I'm able to do it is because my muscles are attached to the joints with tendons and ligaments, and when I stimulate the movement of the joint, the muscles contract and pull the arm up. The only way that it can be done is through the articulation or a joint. So they are very important to actually learn. It also is good to know when you have shoulder or when you have joint pain, where it's coming from. We can diagnose why you actually have that pain that you're having. Muscles of the body are an important topic, obviously. Basically, we're gonna talk about mostly skeletal muscles anytime that you and I have a conversation about working out. Your near skeletal muscles are basically the main purpose of it is to support movement, and without me standing here is all skeletal muscles. My bones would just fall apart if I didn't have the skeletal muscles holding them in place. each muscle in my body is actually maintaining my posture right now. It also gives me strength. So now, of those muscles of your, most of them are made up of the axial system, which are directly responsible for movement of the head and the neck. So 60% of your body body fibers are actually found in the spinal column and in the muscles of your neck, which seems like an exaggeration, but it's true, because anything that runs down the column of your back, all your muscles connect into that through your back. Everything in your front all connects into the same area, and that's your axial system. That's the torso. Now, the appendicular system, which is known as your limbs, is the other 40%. And those ones are, you voluntarily control them. Like, for instance, Nick, if you were to extend your leg out for me, you just controlled your leg. That's the appendicular system of your skeletal system. Now, your axial system is the actual system that you have no control over. A large part of that, what it actually is for, is to keep your chest cavity, your ribs, everything is stable. It actually protects all of your major organs. If you were to think about it this way, if someone were to run into you on the street and you didn't have any muscles supporting your torso, how do you think that would interact with your body?
I'll just fall over.
If you either fall over, what would happen? Would you get winded? Would you hurt something inside you?
Probably, yeah.
Yeah, and so your axial muscles are actually very important in supporting your body and protecting all your inner organs. It's also very important in helping in breathing. Basically, your diaphragm is an extension of your axial system. And if I were to say, hold your breath, well, no matter how long you hold your breath for, your body's going to automatically make you breathe again, because it's an involuntary action. It's not something that you have control over. Like, you can control how fast you breathe, or if you're holding your breath. At the end of the day, though, it's involuntary. So when I tell you to breathe out on an exercise, there's a reason for it. And then a real large part about what we do with our body isn't controlled by something that we understand. The central nervous system, or the CNS, plays a huge role in what we're doing. It receives information from the outside world through the peripheral nervous system, which actually runs through your limbs. Central nervous system refers to your brain and your spinal cord. And that's basically the major area where me sitting here having a conversation with you is interacting with your brain, and then you're getting given the process and the understanding of what you want to do with it. So if I were to ask you to stand up right now, stand. If I were to ask you to stand up and I were to ask you to bend your knees and sit back down, that involved both systems. So your body, you told yourself, using your central nervous system and your brain, it sent neuron signals through your body into your peripheral nervous system, and basically you controlled your muscles and you sat back down. There are nerve endings that run through every single limb of your body, as well as through most of your muscle tissues and your skin tissue. Now, we don't really have a lot of control over our central nervous system in any way. You think you do, you can create thoughts, but those thoughts don't exactly attribute to what your body's doing. The peripheral nervous system gives you signals. So, for instance, if I were to kick you lightly in the shin, the only way that you're going to feel that is because neurons in your leg, they received the signal and sent back a pain signal to the brain, and your brain went, ow. Then it sent back a signal to your peripheral nervous system. It runs through into the leg, and the leg was pulled back. That's essentially how the peripheral and the central nervous system work together. Without the two systems working together, you have no control over yourself. I guess the whole point of me sitting here and talking to you today and going on and on and on about it is to bring up why this is important to you. This, to me, is an important topic because me knowing how your body works is really easy for me to diagnose problems. So if I were to see something in imbalance in your body, I'd understand that it's probably because your joints are imbalanced, or your muscles are imbalanced, or your posture is wrong, and that's things that I can correct because I'm a personal trainer. I have the education to understand what's going on. Me giving you information as my client basically would be that I would tell you how to properly better yourself. So I'd efficiently be able to make you stronger, make your support system stronger, and you'd understand that standing and having a proper posture, me bringing my shoulders back and having your hands at your side, is actually better for your health than slouching over at a computer desk all day. It's very important for us to understand how the body works. And another one else is safety. Like, safety of you at all times is going to be important to me. And knowing how the human body works is very, very important to that part. That's the end of the presentation, but I'm going to talk to you guys about a quick activity just so you guys can understand a little bit better how your body works. So if the two of you want to stand. Now, I'm going to ask you to both do the same thing. Spread out a little bit, just so you have a little bit of room. Now, each one of you needs to put your right hand on top of your head. Now bend your left knee.
Bend it?
Yeah, bend it.
Yeah.
Oh, okay. Just
See, what he did was he understood that his posture can't be taken off by bending his knee up. You can't do both very well. What you did is you tried to raise your leg. There's a big difference between sending out a signal where he's not going to fall. There's no way that if I pushed him right now, he's going to fall because his body's in balance. You lifted your leg. If you lift your leg and I push you, you're probably going to fall over. Now, think about what you did by lifting your hand to your head. It seems like a simple task. Think of how simple that was.
Yeah.
Put your hand back down on your side. Do it again. Put your hand on your head. Think about what you're doing. What is involved in that action? You just kind of sat through a little presentation. Can you tell me like what either of you think was involved in that?
So it's a combination of things, so your joints, your ligaments, and your muscles, in combination with the neurons in your brain signal down to your spinal cord, was it?
Yeah.
And then creates a combination of, I guess it's a voluntary action because you're actually thinking about the process and you're from the top of your head. Same thing with your knee.
Yeah. And that's pretty much it. Like at the end of the day, every movement that we do is involved. It's not just, oh, okay, I'm gonna go do a bicep curl today. If we were to do a bicep curl, now that you have the understanding that it involves a lot more actions, it kind of makes a little bit more sense why every exercise we do is so important, is so difficult to do properly. And if you don't do it properly, you're not doing the exercise right. And I guess it's important to me for you guys to understand that if we're gonna go to the gym after this, we're gonna go do squats. If you're gonna sit back down in your chairs, you're doing an emotion of doing an exercise.
Yeah.
You're bending your knee joint. You're also using your ankle joint. You're also bending at your hips. It's all in line, and your body is a system. And without knowing the system, you can't really do any of the exercises properly or safely. So, do we have any questions today? Nothing?
No, that was very informative. Thank you.
Absolutely.